there, my name is Diana and I'm head of the Safety and Hazards Department at the Alberta Bank of Commerce, and today I'm going to go over the topic of repetitive strain injuries. So in today's agenda, I'm going to do a brief introduction and then I'm going to go over defining, recognizing, managing, and preventing RSI, and then I'm going to do a brief wrap-up. Okay, so it's been reported at the Alberta Bank of Commerce that 4 employees have RSI due to the heavy use of computers. So the purpose of this presentation is just to really go over what RSI is, how to manage it if you have it, and a few of the prevention methods that you could use just to decrease the probability of RSI happening to you. Just because the health and well-being of you guys, our employees, is the top priority at Alberta Bank of Commerce. So according to Tolder and others, RSI is an umbrella term for injuries caused by prolonged repetitive movements, awkward postures, sustained force, and other risk factors. So when pain is found in tendons, muscles, or joints within the wrists, hands, elbows, shoulders, necks, back, hip, knees, and ankles, this is generally linked to RSI. So a common example of repetitive strain injury is carpal tunnel syndrome, as I'm sure that you may have heard of. And an example of a profession that may get carpal tunnel is a hairdresser because of the repetitive movements that they use when cutting hair. So the same applies for using computers all day long. So since RSI includes a variety of injuries, it can be often hard to notice RSI and seek treatment for it. So just as discussed before, RSI is linked to pain found in muscles, joints, and tendons within the upper and lower body limbs. Tyler discusses a 3-stage classification of RSI. So in the first stage, we have aching and exhaustion, which is felt during work, during the work shift on the affected limb. However, this settles overnight and days off work, and the condition can be easily reversed because work performance is not significantly interrupted. In the second stage, symptoms do not settle overnight, causing sleep disruption, and there is also like a reduced ability to perform tasks at work. Finally, in the third stage, symptoms persevere throughout sleep, so it causes sleep disruption. There's a severely reduced ability to perform tasks at work, but not only at work, but like on tasks, like off of work. Physical signs are apparent, and then they also can persist from months to years. So it's important to manage symptoms through seeking medical advice if necessary, or being able to reverse the condition if early enough through prevention methods. Okay, so in managing RSI, it's important to notice that changes in your lifestyle and computer habits must occur. So if the condition isn't too bad that tasks can still be performed, just find ways to type less. So for example, if you normally would email colleagues and such, maybe go talk to them face-to-face instead. If the condition is bad, seek medical attention, because that medical help and advice of the doctor can help you see if further treatment is needed, or in worst cases, maybe surgery. And then finally, it's important to make sure to take time after rest, because it's that time that you take to rest that lets the affected limb really heal itself. Okay, so it's important to adopt methods that will prevent developing RSI. So RSI is usually linked to poor posture, poor methods, and overuse of the computer. So the following methods are recommended to use when working at the Alberta Bank of Commerce. One is to maintain a good posture. The second is to use proper positioning relative to the computer, keyboard, and mouse. And then most importantly, it's important to take breaks, because the time off of the computer gives your eyes a break to rest. And then during this time, you can also take time to stretch, and this really helps strengthen your muscles. Okay, so I'm just going to call my colleague over here, and we're going to show you how to do these methods, use these methods. So as you can see, my colleague's wrists and arms are straight relative to the keyboard and mouse, and then her head is faced directly at the screen and is at least 15 inches away. Also, her back is straight, and you can see the head and the shoulders have a vertical alignment towards the hips. Okay, thank you. Okay, so once again, at Alberta Bank of Commerce, your health and well-being is important to us. The use of computers here is inevitable. So really this presentation was just to recommend methods that you could do and use to decrease the probability of RSI happening to you. So this includes seeking medical advice in case further treatment may be needed, using or having good posture, proper positioning, and taking breaks just to give your eyes a rest and time to stretch in case that is needed. And that concludes our presentation. Take care.